Hi everyone, this is Amanda from Topwind Ranch, and today we're going to talk about equine dentals and dental maintenance for your horse. So I have Johnny here just keeping me company while we chat. Doing your horse's teeth is something that needs to happen every single year. You want to start when your horse is 2 and before you start riding them in a bit. So the first dental exam is going to be checking to make sure that there's no abnormalities, wolf teeth that need to be removed so the bit can sit comfortably, and just overall making sure their mouth is balanced so that we can go ahead and start. After that, it's going to be an annual maintenance thing to make sure they don't develop any sharp edges in their teeth, ridges, waves. As your horse gets older, they could have teeth that need to get pulled, that have decay, just like we do. All right, to prepare your horse for the dental, it's going to depend a little bit on your situation. So here we like to use a professional equine dentist, and what they do is they actually bring it looks just like a horse trailer that you actually walk your horse into. They have stocks in there and all the supplies they need right in their trailer to do the dental. If you do not have a professional equine dentist that has their own rig in your area, a lot of local vets will do dental work as well. And so that might look a little bit differently. But we're going to talk about the 2 different ways and how to prepare your horse. So for ours, using the professional equine dentist, your horse is going to have to walk up a ramp, just like a horse trailer, and into a stock. So you need to do a little bit of prep work with your horse because they need to be halter broke, they need to be able to be touched, they need to be comfortable walking up onto a ramp. So if you can practice at home with your trailer or on rubber mats or bridges or just things like that to get them comfortable, they'll have to walk up in there and be touched for the sedation. So another thing you can practice is just touching on their neck and making sure that they will be prepared for a needle to go in there without too much trauma. So usually when a local vet will come out and do dental floats, if they come to your farm, they're going to need something to be able to throw a rope over and hoist the horse's head up. We'll show you here in a minute what that looks like. But for example, this is a situation where you could do it here in a stall. They would take a rope, they would throw it over the top, and it would be connected to the bottom of your horse, and they will hoist their head up because they need their head to be up so that they can see down into their mouth. So if you're going to have the vet come out to your place, just make sure that you have a place that they can do that. I've seen vets get all kinds of creative with this. If you have a low beam in a barn, if you have a stall, I've seen them do it over a tree branch. It's just going to kind of depend, and if you're not sure, make sure you ask your vet before you have them come out, and I'm sure they'll be able to work with you and figure something out to work. All right, so it looks like our dentist is almost here, so we're going to go ahead and show you exactly what this looks like.
Truckload Dixie crap. Rinse him out. Good boy. Drop the head just a little bit. That's good right there. Okay. So power tools. These instruments get a bad rap because a lot of people overuse them, and we use them very mildly. We use a tissue sensitive diamond that is very easy on the teeth, and it's really difficult to do any damage to the tissue if you pay attention to it. Hang on, big boy. And horses' teeth erupt their entire life. They don't grow. They actually develop and grow to their full length by the time they're about 7 years old. But they do erupt. and wear against each other their entire lives. And that's why they get that's why we come in and do the float, because a lot of times they don't erupt evenly, and this helps them. And this horse has had dentistry before. I don't know if you can see in there or not, but it's not terrible, but there are a few protuberant spots and some highs and lows, and all we're trying to do is make everything match up and balance where the horse can eat efficiently without taking too much off. People always worry about heat on these tools, and there's no heat. A little warm, but it's not hot. It's not going to do any damage to the tooth. I mean, if you're making them that hot, then you're being way too aggressive. Front view that's easy to get to, but all the way in the back. Right now, this tool is designed to take the tartar off the canine. We're not actually cutting the canine down. We're just going to knock the tartar off, which can do damage to the tooth in the long run. I typically finish every horse with hand floats. Just the way I learned how to do it. I like to be able to hear if the tooth sounds hollow or kind of loose. You can feel the wiggle where you can't hear it with the motorized equipment. And it just makes a really nice finish. Kind of evens it out and makes a real nice balance. And this is painless to the horse. It might have a little vibration type sensation, but as far as any pain, there is none. All right, Mark. Now lower his head and drench out all the little fine material. Take one last look in there. I'll take the speculum off and see how well his lateral excursion is. You know, it's just typical horsey mouth. Nothing major, nothing crazy. All right. When you reduce the molars, you always have to reduce the incisors, or it leaves a space in between the molars, because you leave these longer, and we're going to just barely reduce them. I mean, less than a millimeter. We are going to reduce them. And people say you shouldn't do this. A lot of people do. I don't believe that. Incisors are probably the hardest part of the dentistry of the teeth to get correct. I think it's a lot easier for people to draw the card and say, don't do it, than it is to learn how to do it correctly. That's all I took off. Horse has got perfect movement, in my opinion. Okay. Okay. So you get some really tight retained caps that should have came out. A lot of these really small-headed horses have trouble displacing their caps naturally. A lot of people say they all come out when they're supposed to. Well, they really don't. So sometimes they need a little help. And this is going to be a little bit of a surprise to her, but hopefully in just a second she'll feel a lot better. And they actually stink because they got food material packed in them. Ooh, dropped it. We're not going to quit though. We're going to get the other one too. That is a long retained deciduous or baby tooth. All right, mark up just a little bit. She's supposed to shed these at about 2 years, 3 or 4 months. She's 2 years and a half. How old is she, Amanda?
She is a 2020, so she's 3 this year, coming 3.
So she's kept those a lot longer than she should have.
Yes, and it's been causing her issues in her training because she's not liking putting a bit in her mouth with those sensitive teeth.
Oh yeah, it can make them, actually it can just defund the training completely. A little uncomfortable, but not too bad.
Well, just like when kids lose a tooth too.
And of course you want to make sure you have a tetanus on board, because there are some open wounds here. Not too bad. And you can actually, hang on a second, I want to grab that bucket there. How tricky doing this without getting it all over everybody. Those are the adult teeth right there. I can put my finger on the flat cut part of them. Right here and right here. These will be the next ones to go. And then at roughly around 4 years old, the ones on the corners will go. Okay.
So proper dental maintenance is so much more than just keeping your horse comfortable to be ridden. It's also going to be keeping them comfortable out in the pasture and enjoying their life, you know, wholeheartedly. Having their mouth balanced, no sharp points, no painful teeth, no broken teeth, no infections, is going to make sure that they can chew their food properly. It's going to make sure that they stay happy and content in their life, because as you can imagine, if it hurt you to chew and swallow and digest food, you're probably going to be pretty cranky. This can correlate over to working with your horse. You know, you're wondering why it is uncomfortable when you touch the side of its face or something. There could be pain in there that you don't know about. So it's really important to maintain good dental appointments. So if you notice any behavioral issues that your horse is having that may be out of the blue or out of the character for them, this is another good reason to make sure your dental is up to date. Just like us, if doing things that are required day to day, like chewing and eating, hurt us, we're going to probably be pretty crabby, and it's going to correlate over to everything. It's going to correlate over to just handling your horse on a day-to-day basis, and it's definitely going to correlate over into riding. So that's just another reason to make sure you keep your dental up to date. So thanks everybody for watching, and make sure you get those horses' teeth done.